Welcome back, everyone. We've had a busy morning, starting with our keynote and our first panel talking about how we reach the consumer and our executive spotlight, reaching the consumer in the middle of the pandemic. And now we're thrilled to have our second panel, which will highlight consumer engagement and how do we enhance the consumer experience in healthcare. I would like to introduce our panel's moderator, Dr. Jean Abraham, my colleague and collaborator at the University of Minnesota, who will then introduce her panel. Dr. Jean Abraham has been directing the Master of Healthcare Administration program at the University of Minnesota's School of Public Health, where she serves as the interim head of the Division of Health Policy and Management. Dr. Abraham is recognized as a Wegmiller Professor of Healthcare Administration and has received several awards for her research and teaching, including the IHIS Research Paper Award for Best Paper and Leonard M. Schumann Award for Excellence in Teaching. As a health economist like myself, Dr. Abraham's primary research areas focus on private health insurance, including consumer behavior, plan quality, benefit design, innovation, and competition. On a personal note, I am grateful to be a research collaborator of Jean's, as we have extensive line of publications and studies of the insurance markets that goes back to many, many years ago, thinking about the individual market and employer-sponsored insurance market before the Affordable Care Act, after the Affordable Care Act, medical loss ratio regulation, loading fees, among many other topics. Thank you so much, Jean. The floor is yours.
Great. Thank you, Pinar, and good morning or good afternoon, depending on your time zone today. Well, I am delighted to have the opportunity to moderate this panel session on enhancing the consumer experience in healthcare. And we have three wonderful industry experts with us today. We'll do some brief introductions, some table setting, and then we'll dive into some structured Q&A. Before leaving time for about 10 minutes for audience questions. So you're welcome to put those in the chat as we go through this session. So let's go ahead and start with some brief introductions. And I was advised to have each of the panelists maybe offer their own brief introduction to tell us about themselves. So let's go ahead and start with John.
Well, hey, good afternoon or morning, everybody. I'm John Holamka, and I'm an emergency physician. I serve as president of Mayo Clinic Platform, overseeing Mayo's global digital activities. Prior to that, I was at Harvard Medical School as a faculty member and the chief information officer of Harvard and a number of its hospitals. So wonderful to be here.
Wonderful. Thank you. Let's go next to James.
Hey, good morning, good afternoon. My name is James Beam. I'm currently a Senior Vice President of Client Solutions at Press Ganey. Press Ganey is the largest organization in terms of picking up regulatory CMS CAP survey data. So we do a lot of research and analytics around consumers and consumerism. Been in healthcare 25 years, served in a number of different roles in managed care, Humana, Walgreens, and I was a partner at IBM Watson Health, focused on enterprise AI machine learning relative to consumer healthcare data. Thanks for having me.
Very nice. Thank you, James. And let's go to Jordan.
Hello, everyone. Good afternoon. Good morning. I'm Jordan Pasarsek, and I lead product for DocASAP, part of Optum Digital. DocASAP was formerly an independent company focused on patient access and engagement, and we joined Optum last year. I've been in healthcare for about 15 years on the life sciences side for the first part of my career, and then moved into the healthcare technology space for the last 8 or 9 or so. So very excited to be talking with all of you today.
Wonderful. Great. Well, let's go ahead and dive in. And so, when I think about consumerism, this is a topic, healthcare consumerism, topic that's really been around for more than 2 decades. When I think about it in my own career, I think about it really launching with high deductible health plans, tax preferenced accounts, public reporting of quality and patient experience information, price transparency. And of course, the increased availability of care settings that are convenient for consumers via retail clinics, urgent cares, et cetera. It's also, of course, affiliated with the idea of advances in information technology and medical technologies that are allowing us to do more in a variety of ways with respect to understanding how individuals, how consumers and patients interact with the healthcare system, and as well as thinking about delivering care outside of traditional settings. And of course, the financing environment also influences how we think about consumerism, with increased attention on value-based care delivery and financing, and thinking about all the stakeholders at the table who have a vested interest in improving value, including providers, payers, and consumers. So the term consumerism means different things to different stakeholders, particularly in the health sector. And I wanted to kick us off this afternoon by having each of you kind of offer your thoughts about what you think the concept of consumerism means in healthcare and how you would characterize the current state of consumerism. So let's go ahead and start with John.
Well, hey, thanks so much. So my mom is 80 years old. And you know that before COVID, she had not touched a keyboard. And she recognized that if she was going to receive care, receive timely advice, and ensure that she had healthcare quality and wellness, she would have to engage her clinicians digitally. So she bought an iPad. She learned how to type at 80, right? Or 78 at the time. And today, her expectation is, of course, I will get the care that I need. It will be simple. It will be, without any question, cost effective and high value and immediate access, because these last 2 years have taught us that consumers are expecting different care delivery models. So to me, consumerism looks at the culture change of this 2 years of COVID and changing expectations.
Great. Thank you, John. James, additional thoughts relating to what consumerism means to you conceptually and where we're at?
Yeah, I think, even just a few years ago, people were thinking of consumerism relative to other industries, whether that be banking or auto or travel and transportation. But I think, as we all know, healthcare is, way more complicated than other industries. And I think, just as John said, we're coming out of this COVID period where cost, quality, convenience is still a driving factor, but they're finding it in other formats. I think from my perspective, where the journey starts in terms of most healthcare, consumption is through the managed care ranks. And that's where it gets even more confusing on behalf of the consumers. But I do think there are some, interesting things that are starting to emerge. I mean, one of the areas that we focus on that gets a lot of attention is Medicare Advantage. When you think of the 180 million Americans that are covered under a group commercial health insurance plan, there's very little choice in their outward ability to select a health plan or select the benefits or engage in healthcare in any real meaningful way, which is challenging for the payer, but it's almost equally challenging for the consumer. Where we see Medicare Advantage as a true consumer product that looks a lot like auto insurance than it does other products within healthcare. And so I am optimistic that we will start seeing more of these consumer selected type of products and configurations that give consumers the freedom to choose and meet that cost, quality, convenience component on their own.
Great. I like that kind of complementarity of kind of at the point of care, as well as thinking about the insurance market around consumerism. Jordan, thoughts about consumerism from your vantage point?
Sure. Well, I agree with everything that James and John said. I think the only pieces that I would add to it is, I think consumerism is the idea that, patients are purchasing a good and service, and that healthcare is something that is being purchased by individuals, and that they're shopping for it, for lack of a better word, especially with patients taking on a greater share of the cost of care and having the ability to, but also really needing to choose providers in part based on cost and quality. it really becomes much more of a dynamic of shopping for the care that's best for them and most affordable and highest quality. And so I think that's a big part of it. And I like what James said also about, healthcare is more complicated, but than other industries. But I think as part of the pandemic in particular, I think consumers really are expecting healthcare to behave the same way. So they say, I don't care about all the complexity. That's for you to solve for. I want it to be as simple as ordering delivery from my favorite restaurant, right? That is what they are expecting now in this world. And even though healthcare is more complicated, we need to rise to the occasion to make it that simple for them as well, and especially in light of their shopping and preferences.
Yeah, all excellent points for taking something very complicated and trying to make it easier to navigate, and to have as much information as possible to make consumer decision making a smooth and positive experience. So, of course, as we think about technology and technological advances over the last 10, 15 years, just enormous changes across the care continuum as in terms of, prevention, chronic disease management, mental health care delivery, even acute care and hospitalization. And we have, consumers are faced with a variety of solutions available, right? You can access your care on an app, you can have a direct to consumer telemedicine visit, you can have health coaching. You can have home visits that are facilitated via, your electronic medical record and scheduling. So I'd love to ask each panelist to comment on what they see as one or two key challenges or opportunities as you see these new care delivery innovations coming online, and how you think they may work or may not work. There'll be some unintended consequences for the consumer experience. So let's go ahead and start this time with James.
Yeah, interesting. So, I've been around healthcare long enough, particularly within the healthcare digital health ranks and analytics ranks, to understand, there has been a, plethora of solutions that have come forth to the market that just did not, resonate well with consumers, whether that was because there was some, interference on behalf of a provider or a payer. But what I can tell you is that the research that we do and what we've seen consistently over the last several years is that the consumer desire for the, authentic experience is still there. That's what they want. When we measure things like telehealth, coming into this work, we thought, well, it might be, technology hiccups or, sort of the ability to go on board and speak to a provider. But we actually saw the, inverse of that, which is, consumers wanted to spend more time with physicians, and they wanted to bring up other conditions that were not part of that visit, whether that be, mental health, behavioral health, back pain, things that were not relative to see a, physician around a, sinus infection. And so there's a desire there. I think the biggest struggle in terms of, connecting with consumers is the amount of effort it takes on behalf of providers and payers to, deliver meaningful information and communication. I think that is, above all else, what consumers are really looking for, is guidance in this complex matrix of, help my condition and, inform me on what the next best steps are, really.
Yeah, that navigation and direction, and it's a very different period of time in terms of our interactions. I think very much evolving. Jordan, I'd like to hear your thoughts on this question relating to kind of technology and kind of opportunities and potential challenges.
Sure, absolutely. Well, I think we've of course all seen that when healthcare providers and payers and patients get together to try to solve the problem, it can be done. And I was really amazed to see a lot of our customers spin up virtual care appointments and various telemedicine capabilities so quickly during the pandemic. And we've seen that sort of decline a bit over time, but I think it remains much higher than it was before. I think what consumers are in part looking for is something that is a really comprehensive platform available. I think it's really hard when you have a lot of point solutions that are available. So, virtual care's over here, go click this link and it's one vendor, and this is a different vendor, and they all have different sign-ins and, challenges around that. You're entering the same information multiple times in some cases. And I think that's really where there's, in my opinion, a significant opportunity to improve the overall experience for consumers, make these solutions part of a comprehensive platform that can treat a patient regardless of their need. If they want to communicate asynchronously with the provider and say, okay, I'm going to text you this and I just have a quick question, and then, hey, let's hop on a virtual call, or hey, I need you to come in for this one because I need to actually look at you or do some tests, or I can send a lab test to your home and you can do something at home and mail it in. I think the more you can start to create these hybrid environments and solutions that really incorporate multiple different pathways to care, but in one comprehensive experience for the patient, where if they're interacting with Mayo Clinic or any healthcare organization, it just feels like one experience. And depending on their need, they can be sort of routed to that correct experience.
Yeah, that you really hit on an important topic of integration and not having to navigate through and fragmentation and frustration, frankly, I think for many consumers as they try to sort through their options and help, they want somebody to kind of connect the dots and make that seamless. John, I want to turn to you next because I know that you are leading you've led some very big initiatives at Mayo around kind of taking hospital care to the home and really thinking about that as an opportunity. And could you share a little bit more about that?
Absolutely. So here's the question. So Jordan, you need serious and complex care. And I don't mean replacing your ambulatory visit with Zoom. What I mean is you have congestive heart failure, chronic obstructive pulmonary disease, or pneumonia. Do we need to send you to a bricks and mortar facility? Or can we deliver safe, high quality, cost-effective care in your living room? And so this is a question that Mayo Clinic asked in July of 2020. We built a command center in Jacksonville, Florida. Mayo has this notion of starting small, thinking big, and moving fast. We started with one patient, happened to be an 87-year-old with hyponatremia, a serum sodium that was very low, typically a hospitalized condition. We treated this patient back to wellness in her living room. We started from that one patient, then moved to 10, then 100, then 1,000. So as of today, we've seen over 10,000 patients with serious and complex disease in their homes. What have we found? Quality the same, outcomes the same, safety the same, patient satisfaction, a net promoter score of 97%. You never find that in healthcare. Nosocomial infections, that term of art for hospital-acquired drug-resistant infections, 0, because how many people have hospital, type infections in their living room? Not so much. Falls or unanticipated injuries, near 0, because again, you're in your home. And the really interesting thing, readmission rates, less than 1/3 of what you'd expect. So, the value of this care is high. The patients love it. And it turns out for, 10,000 patients, it works. These are the kinds of care models you're going to see going forward.
Great. I love the illustration.
Could not agree more. And obviously, we see that come through in all of the research, all of the CAHPS measurement surveys, the intent of the consumer. And it does not surprise me that the NPS score is above the 90 threshold because, again, consumers are looking for, the highest grade of levels of satisfaction is when they have that, interaction with a provider. It is not common for consumers to rely on a payer for, quality, clinical advice. And so if it's, delivered in the home, you're already, taking out an enormous amount of pain points on behalf of the consumer and, delivering them higher rates of satisfaction than they would see if they have to pull through all of those administrative tasks.
That's right. And then if you couple that with digital solutions that carry them through in between those visits as well, and keep them engaged with their care at the right time and prompt them to do the things that they're supposed to be doing in between those visits, now you have a really, really comprehensive health solution for them that involves going into the home, having them come in if needed, virtual visits, asynchronous communication with the provider, and kind of trigger points to say, here's the next thing to do in your care. So that is a really comprehensive platform to give to a healthcare consumer.
No, all really excellent points, and kind of telling the story of where, kind of a vision for where the healthcare system and the role of the consumer and the experience of the consumer will go. I am interested, as we think about these new innovations, and John, you alluded to evidence of, in terms of data, and James as well, in terms of CAHPS scores. We often think about the importance of having kind of objective, broad-based evidence, robust evidence to inform diffusion of new innovations, as well as policy making and kind of the regulatory environment that helps to support that. And so I'd like to hear a little bit more about your thinking on, what types of innovations are needed, or investments are needed to really, what don't we know yet that we need to do more of to really get more comfortable with some of these new innovative forms of care. Feel free, John.
Okay, hey, happy to start. So imagine the following. We take 10 million patients in Minnesota, lots of Scandinavian Lutherans, and we develop the world's most amazing cardiology algorithm, and then we deploy it in rural Georgia. Is that going to work? Is it going to be biased? Is it going to over or underdiagnose? How do you know? Is there transparency? So as we use more machine learning, which remember is math, not magic, there needs to be, at least industry standards, if not sub-regulatory or regulatory guidance, to say, hey, for an algorithm, we have to understand how it was developed, how it performs on a subset of patients, if it's appropriate or not appropriate. And so you'll see over these next couple of quarters some national efforts in AI transparency, validation, and usability. And we cannot use AI throughout the healthcare system without that kind of at least oversight by the industry or government plus industry.
Very good. Yeah, clearly in terms of thinking about analytical tools and ensuring that we, promote as an equitable, create solutions that will serve all population segments, and being really mindful of how you develop something can dramatically alter how well it will work in other populations or not. As we think about, I want to touch a little bit, kind of circle back a little bit to the issue of health equity more broadly as we think about care delivery, because clearly health equity is on the front burner. We are seeing it a top priority at the federal level, state level, organizations across the board. And when we think about promoting kind of consumer-friendly, consumer-focused solutions, we know that not everyone experiences these solutions the same way. How do we ensure that consumer-oriented solutions like telemedicine, hospital home are in fact what do we think they're going to do in terms of equity in care as well as health outcomes? Any thoughts?
Yeah, I mean, I think from a managed care perspective or a payer perspective, when I put on my actuarial lens, we've always known this. We've known that there's a certain percentage of the population that are driving, plurality of spend that are at risk for whatever reason. And we did not have the capabilities to drill down and to try to figure out who these people are, where are they, what are their social needs, what are the needs in the community that they don't have. And, thankfully, I think over the last 5 or 6 years, particularly after the emergence of EMR data and being able to understand how that ties back to, clinical data, financial data, administrative data, we're able to start getting a better bird's eye view of that. I think the challenge will be is how do we route back out to the community to start addressing the needs of the patients and the members that are non-clinical. And I think that's really, the next frontier. I'm starting to see some really interesting studies on long-term diabetes and hypertension, coupling that up with social determinants of health scoring. we're going to start getting more predictive analytics around social, SDOH scoring, being able to precisely understand, and I think it'll move more past, the academic literature or interesting use cases into actionable plans that, payers, providers, and members of the community can start rallying around. And I think it's sorely needed. It's much needed. And it's, collective information we've always known, but have been, unable to, put some feet on the ground around it. So.
Of course, you can't change what you can't measure. And first, you got to be able to measure, right? And so, I think the national conversation around collection of data, both in terms of race, ethnicity, socioeconomic status at the individual level, as well as health-related social drivers, and both provider and payer, I think is a step in the right direction. Jordan, do you want to add to the conversation around health equity?
Sure. I would just say that I think, as we talk about in a lot of other forums as well, I think representation is really important also, to really have people in the room and on the decision-making boards that, that are serving these populations. And so I think that's a really critical piece of it as well, that we don't, roll out, digital solutions or health solutions without having guidance from the people it's meant to serve and the demographics it's meant to serve. I think that's a big part of it. The other piece I would say is that digital capabilities, telemedicine, and everything else has actually, I think, opened up a point of access. Certainly not everyone has, a smartphone or a computer, but or internet access, which is something to think about. And that's why, Optum and others will have, call outs and agents that will actually reach out to patients that aren't engaged digitally as well. So you have to think about that group as well, but that's becoming a much smaller percentage as time goes on. And so for those folks that have access to the internet and have access to digital capabilities, that's a big enabler also of getting people connected who might have been, 50 miles from the nearest hospital or provider that could really serve their needs, or maybe more. And now when you have digital capabilities to engage, that distance becomes a non-factor. So you can engage rural communities or others who, might not have had access to top doctors at a place like Mayo Clinic, and now they can access Mayo Clinic, from anywhere in the country and get a second opinion. So I think those types of things are really amazing in terms of the ability to open up more access as well.
Yeah, the value proposition through the kind of reduced time cost of travel and I think the increased potential for connection, as opposed to kind of very discrete visits, 2 or 3 a year, much more kind of continual engagement. So I'm going to go back now to a little bit more on data, big data, AI, machine learning, predictive analytics. And, we know that we are creating increasing amounts of data, EMRs, clearly administrative data, other forms of data that are fairly novel. But a lot of provider organizations, particularly some payers, are still kind of on the learning curve of how do you take this raw data and actually make it valuable information that can directly impact patients. And so I'd like to get your insights on thinking about, how do we use AI and kind of this kind of increasingly rich big data sources to enhance the consumer experience or create a more personalized care experience, either clinically or through navigation. And let's go ahead and start with Jordan this time, and then we'll go to John.
Sure. So I think, the experiences that I often hear about, and it's reflected in survey data, and probably James would have more perspective on this too, is, a lot of patients, you have patients that have a certain diagnosis, certainly for more rare diseases, but even not so rare diseases. And they may have very different experiences with healthcare providers, depending on who they see. They'll get very different opinions on what to do, depending on the level of care, the time that the doctor has to spend with them, can greatly influence how much information that doctor is able to process about them and then kind of come to a decision. And so I think one of the big promises of having this much richer data set, shared data across multiple organizations, large data pools, and then being able to run, AI on that, is the ability to surface up more information to help the doctor make a better decision in real time, and to say, okay, based on everything that we know from a larger subset of patient data, we can help to identify or at least suggest some of the either a diagnosis or clinical decision-making abilities to say, here are some options that maybe the clinician who may only have 5 minutes to manage that patient may not have thought of in that time, and they can say, oh yeah, that this is another thing to think about and consult with a colleague about as well. So I think that's sort of the promise as I see it, is let's put that together so that in these very fast interactions that often happen in healthcare environments, we enable clinicians to make the best decisions for the patient.
Great. John, let's go to you next. I know you do a lot of work in this space.
Okay, so when you drive, do you ever use an app called Waze? Wouldn't we want the drivers who came before you to tell you the best path to get to your destination in a timely fashion and a safe fashion? Well, the same question has to be asked about healthcare. But how do you do that? And so Jordan, James, and I, we've spent our careers in this particular area. Mayo Clinic has 23 petabytes of multimodal data, structured, unstructured, imaging, telemetry, omics, and digital pathology. Now, for those of you who don't work at petascale, remember that we started this seminar a kilosecond ago. And a petasecond ago, there was a brontosaurus running around Minneapolis. It's a big number. And what we did is we de-identified, using a sophisticated natural language processing and machine learning approach, the unstructured data, removing such things as job titles or geography or familial relationships, so that we could then bring in partners throughout the world into the de-identified corpus of data for algorithm development, new analytics, and new visualization development. They cannot take the data with them. It is never out of Mayo's control, but they can develop new insights. And I tell you that because none of us in any organization has a data set that is big enough to serve all patients. We are going to, as a society, recognize the need for a distributed data network of de-identified data used for algorithm generation, training, testing, and validation. And that is really what we are doing at Mayo as one exemplar, and engaging government, academia, and industry to expand that to larger scale.
John, just follow up. Can you share a few examples of kind of the most promising kind of clinical or applications to kind of clinical care that you see happening around algorithm development?
So we have about 60 of them, but let me give you a couple of. Do you remember the film Minority Report? That is, we could predict what crime you would commit that you haven't committed yet. What if we could do the same thing with disease? Well, we've already done it in both breast cancer and certain kinds of cardiology diagnoses, like future atrial fibrillation or future congestive heart failure. We can take your Apple Watch lead 1 data, and with an area under the curve of 0.92, i.e. good, tell you that in the future, you are going to develop congestive heart failure or pulmonary hypertension or valvular disease, right? So what does this mean? It means that we can move from episodic care or symptom-based care to pre-diagnostic care and prevention. And really, ultimately, that's what we all would like. We want wellness. We want cost-effective early diagnosis that's non-invasive and not heroic. And a number of these algorithms are surprisingly good at forecasting events that haven't happened yet.
Great. Thank you. I appreciate that kind of extra bonus kind of explanation there. James, let's turn to you on this issue, because clearly in the consumer experience space and CAPS and other organizations are very interested in these data as they are competing with one another and trying to earn the loyalty of patients.
Yeah, and I think what John said is the promise, right? And I think, getting to a level of, a distributed network that can, host and support a consumer marketplace is where we will meet consumers at some point in the future. I mean, you think about the diagnostics that go into your car and you probably have a better maintenance schedule on your car than you do on your body. And, I think this is where consumers want to go. They want to be able to get home testing. They want to send testing back in. They want to go to a retail pharmacy clinic. They want to have their care, produced there. They want a greater length of healthcare literacy around, what is the biology of their body and how can they take steps to prevent future disease. I think these are some of the themes that we see in the research and that we see coming from consumers, because they keep going to this spot. They keep going to, I put a high preference of, goodwill on those that are giving me the best advice. And I'm putting an enormous amount of satisfaction around cost and quality and making it more sort of efficient for me as the consumer. I think having this, common marketplace is going to produce a whole range of benefits. I mean, what we still see in the payer segment today is if I'm insured under Plan X and I move to Plan Y January 1st, Plan Y has no record of my prior year's history. These are things that consumers are so frustrated with. And then year after year, they get their copays raised and their deductibles raised and their HSA limits raised. And it almost engenders a level of frustration with them. I think creating, a new landscape for them to be able to understand how they can get care outside of the, large incumbent space is where a lot of our consumers, that's what we're seeing in the research, is they're, trying to find, alternative pathways. And I think, data and all of the sort of, benefits of, solutions that can be built on top of data is going to be very appealing to consumers.
Yeah, great. Those are great insights. And I appreciate the part about switching costs, whether that's switching payers, switching providers. They all, for the consumer, it often means hassle and frustration as they get to start over sometimes with, repeating their history and learning. So I next want to turn to, and feel free, folks in the audience, to add questions to the chat if you are interested. I want to now turn to value-based care delivery and purchasing. I teach our private purchasers of healthcare course at the university, and we have spent, more than a decade now really experimenting with value-based purchasing models. We continue to learn. I think we haven't discovered any magic bullets in terms of what works or what doesn't in terms of the academic literature. But I think one of the most striking things about value-based purchasing is that it's really, we hear a lot about the payer and we hear a lot about the provider and their interactions. We don't hear so much about the consumer's role in generating value. They are often treated very passively. So I would like to ask our panelists to comment on how they think consumerism fits into the future of value-based care delivery and purchasing. I'm going to start with James this time.
I think, the consumer's perception of value-based care is rather limited. But the major themes that flow through value-based care, cost, quality, experience, are things that I think a consumer is, leaning into when it comes into choice and selection and being able to find the highest level of clinical guidance that they can. I think, the most interesting thing for me in the last couple of years has been the emergence of, hard data and hard science around value-based care. And I think as we start going further down this pathway, understanding, is there a, demonstrated relationship between having a positive experience with a provider or a payer and the outcome of that patient's health. These are things that we haven't really been able to quantify all that well in the past. And I think if we can, and we can start demonstrating that directly to consumers, healthcare will operate in some ways like other industries. Again, I'll go back to the Medicare Advantage example, that from our research perspective, that looks very closely to the auto insurance world. And, the behaviors in auto insurance in terms of getting their arms around that, customer, it is a well-tuned science. They start over communicating to their auto insurance members 9 months before any sort of premium increase will happen. That is a little bit different than what we see in the health insurance world today. So, I am convinced that if we're able to, demonstrate to consumers some of these major themes within value-based care, it is, in some ways, instinctual to them, and it'll just flow through that pathway.
Yeah, no, great perspectives there. And I completely agree that I think Medicare Advantage is a fascinating market segment. It is growing rapidly. It is changing. We are seeing all kinds of innovation in benefit designs, and it's kind of the frontier, and along in some ways with the individual market, both, clearly very different population segments, but both showing quite significant innovation in terms of what they're trying to offer to consumers to meet their needs. Jordan, let's go next to you on this question.
Sure. I think one of the promises that I see of value-based care in terms of what it means for the healthcare consumer and a patient is, I think it aligns incentives the right way for the provider to be really thinking the same way that a patient does about their health. I think, not to say that in a fee-for-service model, a doctor or provider is not thinking of the best interest of the patient, but oftentimes there are sort of many choices given, and we've tried to get away from sort of the paternalism of medicine, but sometimes it almost feels like we've gone the opposite way, where it's, we can do all these tests and give you a lot of different options, and then you kind of choose what's best. And I think sometimes that is what tends to happen in the traditional fee-for-service model. I think in a value-based care model where you have providers that are incented based on the quality care that they deliver, the costs are aligned, there's ratings that sort of hold them accountable, and you give them the tools from a digital and technology standpoint to enable them to be successful, and you bring in things like big data and AI to help as well. All of a sudden you have a situation in which doctors are empowered, providers are empowered to give patients the best care, and the incentive structures are aligned. The patient is trying to get the best healthcare delivered. The provider's, also incented to make sure that that patient gets the best healthcare delivered, and that they will use the technology and digital tools to help get the patient there. So that to me is really exciting and really compelling, and I hope we can continue moving along in that journey.
Alignment is the key word there. I appreciate that. All right, I'll ask John if he has any final remarks, and then we're going to turn to audience questions after that. So John, any thoughts around value and the consumer's role?
Here's my dream. So I've been a vegan for 25 years. I'm 60 years old. I have had virtually no healthcare claims in my adult life. So I went to one of the leading HMOs in this country and said, to James' example, if I drive a car for 20 years without an accident, my premiums go down and I get benefits. Well, I haven't had a claim in 25 years and I'm a vegan with a body mass index of 21. Where's my safe eating discount? And you know what the HMO said? Thank you so much for giving us your premiums, because all the smoking Kentucky Fried Chicken eaters that are ending up with heart attacks at age 39 really need your funding. It's a problem. How do we align incentives, as everyone has said?
Very good. Well put. Good example too. Appreciate that. All right, Pinar, you're going to help me navigate the Q&A. It looks like we have a variety of questions asked, some really good ones, I think. Do you want to start us off?
Yeah, thanks. First of all, thank you so much to all of you. So I guess I'm going to start with two themes. One of the themes, you all have talked about these new technologies, different models. And so one of the questions is sort of two of them at least are relating to this sort of responsibility and engagement of people. So one of them is talking about, with ongoing transformation and availability of all of these new technologies, whose job is it to ensure continuity of care? hopefully the answer is not the patient consumer, is the audience is reflecting on. And then the irrelevant one is sort of when we think about the consumer, we clearly, hopefully again, the answer is not the consumer, but consumer is going to be part of that solution, is the question about how about the consumer who isn't as savvy as everyone on this call? How will these innovations interact with them? How will that interact with their social determinants of health? So that's sort of one theme of responsibility, alignment again, and whose responsibility is it to provide continuity of this care and access.
All right, we'll open it to the panelists.
What a great question. So my mom, as I mentioned, is 80. And I told her, don't you note the interoperability rule and the information blocking rule now enable you to download your entire comprehensive longitudinal medical record to your phone? And she said, well, why would I want to do that? And what could I do with it? And I said, well, what if I, as a physician, were your care traffic controller? And she said, oh my God, it would be so wonderful to have a care traffic controller. I would delegate the authority to download my lifetime data and coordinate my care. So this is not an answered question yet. Will it be a provider organization, a payer organization, a novel startup, all of the above? We'll see. But I would argue we need care traffic control.
Yeah, and I would agree with that, but I would also back up that with the fact that we see that in the research. We see that with every NPS survey we measure, every CAP survey, every research event, is that the top priority on behalf of patients and health insurance members is help me with my care coordination. It's one of the reasons we saw a huge jump over to the retail pharmacy clinic world, is that consumers were like, well, if it's up to me and I have to start coordinating my own care, I'm going to find it in my local, pharmacy. I think that's one of the biggest opportunities for both providers and payers. And, incidentally, when we see the intersection, I think Jordan brought this up earlier, around, the integration of provider and payer is where we see the highest rates of satisfaction, engagement, and experience, is because all of those inefficient, admin tasks that have been, asked of the consumer in terms of care coordination has been smoothed out for them. As John said with his mother, consumers are looking for real guidance and help me get over these hurdles around trying to just make an appointment and go see my physician and see me through my, clinical state.
Great. So the second big picture question is sort of around AI. I know you already talked a lot about it, but maybe another reflection as I wanted to group these questions. So one of them is about, these digital enabled virtual first solutions. A lot of them are AI-based clinical decision support tools. Some of them are more workflow related, improving the administrative efficiencies and such, and complementing the clinical teams and standard of care. So I think the question is sort of asking about that provider-patient interaction, like who decides to use it, who decides which solution to use it, who decides to pay for it. And then another one kind of related is about, can the speakers talk a little bit about how this information and AI fits or doesn't fit into the current ways of establishing clinical guidelines? So some sort of commenting more maybe on the acceptance of AI from doctors and practitioners. So I guess, like, again, big AI question is about, like, how are payers approaching it, how are doctors approaching it, how are patients approaching it. Again, that kind of responsibility, and who decides to use it, who decides to pay for it.
I would maybe just start out by saying, I think in our research and what we've seen, the provider is still largely the most trusted resource that a patient has in their care, and no technology, and certainly not a payer is a fill-in for that. The provider is the biggest source of truth for the patient, and I think that's why it's so important to think about how do we empower providers to have the most information and the right tools, and even to suggest, hey, patient, can you use this, this digital platform? If you have a smartphone, you can do it, right? and to have them be the front lines of getting the right information, and then also becoming sort of advocates or champions to the patient to say, here's something that you can use and here's why, because they are the trusted link in the chain, if you will.
Well,
and I would argue that the AI needs to be invisible. And here's what I mean. If you give a clinician more pop-ups on their electronic health record, they're going to quit, right? Our clinicians are burned out and stressed and anxious. If you say, oh, physician, for the patient in front of you right now, 10,000 other patients like them had this care pathway. Click this one button and you'll get that care pathway. They'll say, oh my God, this EHR is finally useful. And so the work that I think we're going to be doing over the next couple of years will be the workflow integration of AI on the back end that makes it virtually invisible and frictionless for our payers, our providers, and our patients.
Very good.
Yeah,
Well stated. James?
I would agree. Just like you see the use of AI in other industries, it's not going to be visible and it's not going to be transparent to the user, but it'll help the user, and it'll break down all those manual tasks or inefficient tasks that led to errors and led to other issues, within those industries.
Very good. Very good. Well, I think we are at time now. So I just want to again thank our panelists, John, James, and Jordan, for helping us kind of navigate the kind of consumer experience in healthcare and really raising some important issues as we kind of chart the course ahead. And thank you, Pinar, again, for the invitation to participate in Convene. And I think we will close it here.
Thank you so much for this panel. And there are lots of people to thank for putting together this event like Convene. So I want to genuinely thank each and every one of our speakers today. You have really provided many, many insights that are extremely valuable to our healthcare community. And as a researcher myself, and I think Jean will agree, like lots of insights for us and lots of research gaps that we identify from the measurement, from the alignment and the incentives. We truly, truly appreciate the time you've set aside today and for your ongoing leadership you provide to our broader community. I also want to thank our moderators, Dr. Arkel Giorgio, our executive in residence, Gopal Khanna, also an executive in residence, both at the Carlson School, Ameza Reitmeyer, who's a Carlson alumni, and of course, Dr. Jean Abraham, who's a professor at the University of Minnesota School of Public Health. I want to thank our sponsors, our presenting sponsor, United Health Foundation, our gold sponsors, Medtronic, Optum, and University of Minnesota Office of Academic Clinical Affairs, our maroon sponsors, Blue Cross Blue Shield of Minnesota, Frederickson, Byron, and Mayo Clinic. And again, our steering committee, thank you so much for your devotion to make this event a success. It just would not be possible without your support. And our audience, finally, thank you again for attending our virtual event today. We hope that you found our speakers engaging and informative. We hope that you took notes as I did. In order for healthcare to be innovative, it is really important that we come together in a collaborative spirit with the academia, with the industry, with the community, business world, public health, policy world, all of that together. And that we hope you were inspired by today's topics, and we look forward to future collaborations together. And please consider following our new center, Business Advancement Center for Health, BAC. It's a beautiful name, on our social media and our upcoming events where we share updates, and please subscribe to our newsletter. And now please join us for a virtual networking session as much as we can do in this virtual world, which we will begin in a few minutes. Please use the Zoom link that you just received in the calendar invite, or follow the link that our program has put in at the chat. So we will keep this alive a little bit as people can transfer to the virtual networking session. Thank you so much again, and have a great, great rest of your day and rest of the week. Have a nice day.